In this video, we're going to look at groin strain and what you can do from a myofascial point of view to help if you have suffered from this. So groin strain is where the muscles that feed into your pelvis can become strained or injured. So in particular, you have a group of muscles here on the inside of your thighs called the adductors. Their job is to bring your legs together, and these can become strained, particularly in certain sports or certain movements. So anywhere where you've been perhaps running or moving fast, you then plant your foot and turn, can cause strains in this area. So particularly sports like football, rugby can cause this, but also people can suffer from groin strains for many other reasons. When this happens, you have pain in this area. Sometimes it can also feed up into your groin and internally. So sometimes people start to suffer from internal pelvic pain as a result of groin strain. And also involved in the whole restriction in this area are your hip flexor muscles, which are the muscles here that sit deep under all of your internal organs. Their job is to lift your legs as you walk, as you run. So between them, the hip flexors and the adductors are the main areas of restriction that can then lead to groin pain. So what we're going to do is some exercises that can help to release these areas. The first one we're going to do is a stretch for your adductors. So to do this, you can do it, the easiest way to do it is sitting. I've got my back against a wall, so it's supported. I'm going to bring my feet so that they are, soles of my feet are touching, and then just let my legs drop out. So this will create a sense of stretch into my adductors. Now, if you've had a groin strain, this may feel too much because things are restricted. If that's the case, then use a pillow to support your legs. So you can use a pillow on either side, or if you've got one side that feels tighter than the other, you can use a pillow just on that side. So when you're doing myofascial stretches, the idea is to progressively allow your body to release and let go. You don't have to do a set of short stretches, those are muscle stretches. From a fascial point of view, it's one long continuous stretch for at least a couple of minutes, which allows time for the fascia to start to let go. And because the fascia wraps around and through all of the tissues in this area, it can cause some of the restrictions that you feel if you've injured the area. There can also be small areas of scar tissue in the muscles and the fascia, and they can be contributing to some of the pain that you might be feeling. So if this is comfortable, then be here for at least a couple of minutes. If you want a slightly deeper stretch, you can rest your arms on your knees, and this will stretch things out a little bit more. In this next exercise, we're going to use myofascial balls to help to release the tissues. So this is a myofascial ball. It's inflatable, so full of air. And what these are good for is to help to release fascia, because fascia likes slow, sustained pressure, and it likes heat. So by leaning or lying on the ball, you're providing that pressure, and the air in the ball will start to heat up from your body as you use it. So we're going to start by doing some work on the adductors. To do this, I'm going to lie on my front, and I'm just going to bring this knee up into right angle position and then place the ball on my adductors, so under the leg. When you're doing this, make sure that you can relax your body as much as possible. So you might want to use a pillow to support your head, if that's more comfortable. And if you find that doing this on the floor is too much, then you can do this on your bed as well, which is a bit softer. So whatever works for you is fine. The main thing is to be here again for at least a couple of minutes to allow time for the tissues to start to release and let go. And while you're doing this, you may get a sense of things softening or lengthening, and you may get different sensations that come and go. And that's all fine, that's just all fascial release happening. When you're here with the adductors, you can place the ball wherever you want. So I've got it about midway, but I could place it further up towards my groin or further down towards my knee, depending on where I feel that I want to release the tissues more. And just remembering that each place that you use the ball on, you need to wait for a couple of minutes for things to just start to release and let go. And you can work on both sides. Even if you have a groin strain just on one side, it's always good to work on the other side as well, because that other side would have been doing more work to support the injured side. So by releasing both, you're helping to create a better balance in your body. And then from there, we can then use two balls to work on the hip flexors. So your hip flexor muscles are here at the front, they're deep under everything else, under your internal organs, under the muscles, and they attach onto the front of your spine. They come through your groin and then attach onto the back of your thigh. So again, these can become tight and restricted, and they can contribute to groin pain. So to work on these with the balls, just have a little feel of the front of your pelvis. You'll feel pointy bits where the pelvis ends, and then just inside the pelvis is a soft bit, and that's where you're aiming for. So then place the ball on either side. Again, lying on your front, place the balls, and then just relax your body around the balls. So this, again, initially, things can feel quite tight, and you're just waiting for a sense of release and things starting to let go. Because the muscles are so deep in your body, sometimes it can feel a bit like indigestion when you start to work on your hip flexors. But waiting, you'll get a real sense of things softening and lengthening. And as long as you're here for at least a couple of minutes, then the tissues will be starting to release and let go. This exercise is also great for anybody who does a lot of sitting, because sitting tends to make your hip flexors quite tight. So this will help rebalancing your pelvis as well as reducing groin pain. You can find more information about myofascial release and self-help exercises on our website, where you can also get our kits. And you can also find lots more videos like this on our YouTube channel.